Today from Chancellor Eric Fingerhut and State Superintendent Deborah Delisle about how we are working to protect Ohio students. And Hamilton County Health Commissioner Dr. Tim Ingram and Dr. Mona Prasad will discuss the role of local communities and individuals in prevention. Dr. Jackson.
Good morning. Thank you, Governor. As of today, Ohio is reporting widespread influenza activity to the Centers for Disease Control and Prevention. Such activity is certainly unusual for this time of the season, so what that tells us is that H1N1 flu pandemic is strengthening and is showing no signs of slowing. I think it's important to put into context how past flu pandemics have behaved and what impacts those viruses have had on public health. 1918 to 1919 Spanish flu, Ohio reported 1,113,797 cases and 8,602 deaths. The 1957 to 58 Asian flu, one or more outbreaks were reported in 71 counties with deaths in 63 counties in Ohio. The 1968 to 69 Hong Kong flu was very mild, similar to the seasonal flu. So what are we doing in Ohio with this pandemic? We in Ohio monitor influenza in multiple ways, including emergency department data, sentinel physician providers report, and cases of influenza-associated hospitalizations. Since August 30th, 89 Ohioans have been hospitalized with influenza, 32 of which are laboratory-confirmed H1N1. Sadly, we know at least 4 Ohioans who have died since the spring from H1N1. Nationally, from August 30th through September 19, 2009, 16,174 people have been hospitalized, with 1,379 deaths from influenza and pneumonia. While every death is tragic, each year nationally, 36,000 individuals will die from influenza, with approximately 1,300 of those deaths occurring in Ohio. So what are we doing to protect the health of Ohioans? Today, we began shipping antivirals to various community drop sites throughout the state. We have approximately 2 million courses of treatment to be used only when commercial availability becomes limited. On Friday, October the 2nd, ODH ordered, the Ohio Department of Health ordered 61,500 doses of FluMist H1N1 vaccine from the Centers for Disease Control. This H1N1 vaccine is expected in our state in the next 24 hours. This initial allotment will be in nasal spray form and is not recommended for high-risk individuals and pregnant women. This vaccine contains a live, weakened virus, while the injectable form contains an inactivated virus. This vaccine is approved only for healthy people 2 to 49 years of age. Because of this, and because the vaccine supply will be limited, the initial batch will be supplied to local health department and hospitals. They will focus initial vaccination efforts on healthcare workers who provide direct patient care and EMS workers and other health professionals who provide direct patient care respectively. And this is very important to note, that while initial quantities may be limited, increasing numbers of vaccines will be coming to the state each week. The Center for Disease Control assures us that there will be enough vaccine for all who want it as we move forward. More than 4,500 Ohio medical providers have pre-registered with the Ohio Department of Health to receive and administer H1N1 vaccine to high-risk groups when it becomes available. In addition to the healthcare and EMS workers already mentioned, priority groups include pregnant women, people who live with or care for children younger than 6 months, all people 6 months to 24 years of age, and people 25 to 64 years of age with chronic medical problems. Unlike seasonal flu, H1N1 does not appear to cause increased risk for those older than 65 years, so they are not part of the priority group. H1N1 vaccine will be made available to other populations after the priority groups have been served. If you are interested in knowing where the availability of the vaccine is in your community, I encourage you to contact your local health department, or you can call the Ohio Department of Health information line at 1-866-800-1404 during business hours. A searchable list of local health departments in your areas are available on the Ohio Department of Health website. The Ohio Department of Health encourages all Ohioans to get a seasonal flu vaccine. While this vaccine will not protect you against pandemic H1N1, it does provide protection against seasonal flu viruses expecting to circulate this fall. People older than 65 and those with chronic medical conditions are among those at greatest risk from complications from seasonal flu. Although getting vaccinated is the best way to protect yourself, there are everyday common sense actions that are so important, and the governor spoke to you about those, and I'm going to repeat some of them again because they are so important. Covering your nose and mouth with a tissue when you cough or sneeze, or cough into your elbow, as has been demonstrated. Frequent hand washing with soap is extremely important, or you can use alcohol-based hand sanitizers if soap is not available. Avoid touching your eyes, nose, and mouth because germs do spread that way. And please stay home if you're sick and keep sick children away from school.